Well, I think what we're seeing is that global drug policy is clearly changing. There is a major rethink of international policy happening at the international level. So it's not really a question of whether states should change drug policy or start to shift the strategy, it's how. We don't really have an answer of what global drug policy will look like in 5 or 10 years' time, but we can start to move it in a better direction. And this is based on things that we've learned over the last 3 or 4 decades. Things like spending vast amounts of money on law enforcement, crop eradication, interdiction, incarceration is not effective ways to manage this issue at the international level. And what we've learned is that public health interventions are by far the more cost-effective way of dealing with this. And what the UN provides and what international forums provide is a coordinating mechanism for this, a venue where states can come together and figure out what is the best way to actually disseminate evidence to pursue better policies. And that's the shift we need to see. We need to see international forums, rather than being discussion venues for counter-narcotics efforts, being discussion venues for public health efforts. How do we minimize HIV transmission? How do we minimize hepatitis C? How do we look after human rights for people who use drugs? All these sort of core questions. And there needs to be a shift in thinking around this. And that's what we can hope to see in the next 0 to 5 years. And hopefully resources will follow that kind of shift in thinking, and we'll start directing resources to more effective ways to manage this problem.